good afternoon, everybody. It's an honor to be here today, and I'm very grateful for this opportunity to address this subject with this audience at Alzheimer Europe today. So, and my subject, but I better begin with telling you that I did actually submit my abstract under the heading of education and training. So I came a bit surprised when I saw that my presentation was categorized within nursing home care. I had indeed intended to talk about enhancing nursing students' understanding of the experience of person facing dementia by interviewing a close family member of that person, both in the community and in nursing homes. But for the purpose of this session, I will only bring forward the nursing home perspective. It is probably fortunate because of the time limits. So, but to begin with, I want to give you some idea of formal learning about the elderly in Iceland. Gerontological nursing is a 10-unit course taught in the spring semester in the third year of a 4-year baccalaureate program of nursing in Iceland. The goals of the course aim at the following learning objectives: that the student will be able to address changes in the status and circumstances among the elderly and will be aware of issues accompanying advanced biological age. That the student will be able to explain the changes of aging and clarify the health of the elderly. And 3, that the student will be able to assess the condition and well-being of an elder. As you can see, these 3 first goals are interrelated and all refer to the health and well-being of the elderly. The 4th and 5th goals are more the subject of my talk today. The 4th goals says that the student will understand how the patient facing dementia and his or her relatives are situated and how they feel about the circumstances. And the 5th goal states that the student will be able to discuss and take stance towards the possibilities and the responsibility inherent in the role of the registered nurse in the services for the elderly, especially in collaboration with the family. Means of developing theoretical and clinical understanding and skills in the course refer to theoretical coverage and clinical coverage. And the theoretical coverage reflects the main emphasis of the course and include the experience of aging, ages, the demographics of aging, introduction to gerontological nursing, theories of aging, physical and psychological changes of aging, nutrition and aging, health and well-being of older people, healthcare and social services of the aged at the home, and the family of the elderly. And it continues in a very compact manner, as you can see. And I'm not going to read it anymore. But this is, after all, a 10-unit course. The clinical coverage is organized in many clinical sites. There are geriatric hospital units, day hospital, daycare units, both general and dementia-based, nursing homes, community centers, both social and church-based. And I just want to give you a quick glimpse of the clinical sites by displaying a few pictures. This is the sitting room in a daycare center, very nice one. And this is a staff person and the guest in another daycare center taking a walk. And this is a dining area in a nursing home. This is a sitting area in the same nursing home. And finally, there is a private room in this very same nursing home. So this is just to give you an idea of the places where my students go. But there are quite a few clinical assignments. And they are based on lectures integrated through weekly seminars, discussion, and feedback from clinical advisor and clinical specialist. as the students are given the opportunity to develop relevant clinical skills for this particular field of practice. Teaching coverage devoted to reach the goal that the student will understand how the patient facing dementia and his or her relatives are situated and how they feel about the circumstances encompasses 2 lectures and 1 week field work or training with 1 seminar and 2 assignments. As you can see, there is a rather limited theoretical coverage, but all the more clinical coverage. And the students' assignments during the 1 week field work in special unit for people with dementia aim at enhancing assessment skills with observation, interviews, and conversation, of course, filled with some different tools, application of different tools. And then there is this assignment, learning to approach families while addressing issues relevant to the particular practice setting within the care of person with dementia. There are 2 sides of the clinical assignment, learning to approach families to address issues relevant to particular practice setting within the care of the elderly. One is the use of interview guidelines to explore family members' experience of supporting or caring at home for a close relative suffering from dementia, and the other one is the use of interview guidelines to explore family members' experience of visiting a close relative with dementia staying in an institution. And I will only address the latter in this presentation. These 2 sets of guidelines are developed by the principal teacher, that's myself, and they're based on my research work. I did my dissertation at University of California in San Francisco, and that's at University of California is actually my teaching institution because I did my master education also at University of California, San Francisco. And I just came back from Compostela, and I was very glad that when I saw that the medical faculty was situated at the San Francisco Road. So I could find my way around. But both of my research has addressed the relationship between family and staff and its implication for staff's care approaches in different settings. First, I started in nursing home, and then I worked in daycare units. I have to emphasize that the setting up of the assignments is very complex and depends entirely on the cooperation with the registered nurses in the nursing home or the unit managers. The clinical advisor or the registered nurse selects an elder enjoying services in the respective unit and asks the individual and his or her closest family member for the willingness to participate in the student's clinical experience as to allow the student to observe the condition and circumstances of the elder in this particular service unit, as well as allowing the student to approach the family member for interview. I'm very firm on use of interview guidelines because as the structure and content of the interview guidelines help the student to focus and frame their discussion with the family to elicit important information for practice by listening to the family concern for the elder. It is very clear on my behalf that you have to ask the right question to get relevant answers. You are not looking for right or wrong answers, you're just looking for relevant answer. Then you have to ask the right question. I'm just going to skip this very quickly, because this is the interview guideline for students that go into the home of the clients. But this is interview guidelines for students to explore family members' experience of supporting or caring at home for a close relative suffering from dementia. But I just want to pause with this. This is a 9-question questionnaire, but I just want to pause quickly with this 6th question that asks, how would you describe the support and care that you provide for this family member? And I get always very fascinated when I see the difference between the answer between spouses and the children. The spouses think it's just, they've been living together all the time. They're just looking after their spouse as they have always done. But the children, they count the hours. Anyhow, this is the interview guidelines for students to explore family members' experience of visiting a close relative staying in an institution. There are 6 questions, and the first 2 refer to the visits and how the family member arranged the visits and how the family member feels about the visit. And there are 6 questions, but almost all of the questions are also with some prompts for the students to help them along the way, so they don't get lost in the interview. And these next three questions are more about how the visits proceeds. It's questions asked about how the family member can observe the care in the unit and what kind of relationship they have with the staff. And then there is the 6th question, and the 6th question is kind of often the main subject of the interview. The 6th question asks, which aspects of your family member's care do you find most important? And this question is prompted by the asking, is there something particular in his or her way of being that you think is important to nurture? And are there any particular practices or habits regarding physical necessities like personal hygiene and the care which he or she requires help to go about that you find important to sustain? And I must say that the answer to this question are often very lengthy, because the family member has very strong meanings about how you should go about the family member's care in the nursing home. During the seminar, during this one-week field work, we address various issues of care of the demented person, both in light of the interviewer experience and the various films that the students have been watching. And they can pick any one of these 3 or 4, I have more or less 3 or 4 choices. They can pick one film to look at. And then we talk about the experience of caring for a demented person. And this kind of, do you know the film Iris and Song for Martin? It's kind of very, I like to address the different responses of the spouses in Song for Martin and Iris. They're very, very different. Anyhow, both the films and the interviews bring forward the many features of the experience of a person with dementia, like that there's a long stretch from the first glimpse of the symptoms in dementia to the devastating ones characterizing the residents of a nursing home. And then we talk about how the disease process affects the behavior of the client in an individual manner, and how the nearest and dearest of that person respond differently to the changes in behavior of that person and different pattern of daily life of the family. And each student is kind of, I really like it, they are very eager when they speak of their assignment. And typically many of them will say proudly, my client is not all that demented. So suddenly they think the term demented is not right anymore. So they say, my client is not all that demented. He does all these things, and then the history follows about the doings and the way of being of that person. So this is actually, I think this is a very good learning experience for the students, and the family members they interview are usually very open and ready to talk about their experience. Anyhow, the question pertaining to the student's experience asks if the clinical assignment successfully eliminates stereotyping of the experience of the person with dementia. The critical issue, of course, is whether the students will see the experience of the person with dementia and his or her family that are facing dementia together as a one of a kind. Thank you very much.